Hello, we are Team 31 and we have made clinical guidance. The team has 3 members, Christian, Gavin and Stefanos. Our clients are doctors Albert Furrow, Emma Williams, Sam Stevenson, who are all part of the Guy's and St Thomas NHS Foundation Trust. Clinical Guidance is a mobile application developed for Android to enable wider access to guidelines produced by the Guy's and St Thomas Trust. These guidelines provide insightful information to guide doctors in carrying out correct actions and may help them in prescribing medication, providing advice and diagnosing symptoms. Our app is designed for easy offline access to improve the application's accessibility as well as enhancing the user's experience to efficiently navigate through an array of complex decisions. Additional features include a search to easily find any related guidelines, bookmarking to save the most desired, and analytics for tracking the usage of the app. The main requirements of our app include the following. The system shall allow the user to navigate decision algorithms in specific guidelines, include a way to search through the database, provide at least 10 guidelines, have a user interface which is clean and intuitive to use, shall not allow the information on guidelines to be changed without the required permissions. Moving on to the system architecture. The system architecture for a mobile application is rather simple. This is due to the requirements we agreed upon with our clients, and these requirements do not require the use of many different technologies. The system architecture consists of the mobile application which the user interacts with, internal storage in the user's mobile device, and a Firebase cloud server. The mobile application will be running on the Android mobile operating system. The internal storage will store the JSON files which contain the guideline data, as well as the bookmarking information. And finally, the Firebase cloud server will record all the analytics taken from the application. We're now going to show you the key features of our application. First of all, let's start with searching. Searching can be started on the main menu, or when you press the View Guidelines button. Then you can select the guideline you have searched for and navigate it. This is the first page you get when you open any guideline. The app will display all the steps until there is a decision to be made by you. Additionally, when you see more information being referenced, you can press the Additional Information button on the bottom right of the screen to see further guideline data which may provide more guidance. Back to the main guideline view now. There is also the option of Document Details at the bottom of the page, which will display the details of each guideline, and this can include its authors and its change history. And finally, there is the option to bookmark a page by selecting the star at the top of the page in the main guideline view. Once this is done, you'll be notified that this guideline has now been created. The bookmarked guidelines can be found under the Bookmarks option on the main screen. All in all, we can say that the scale of the project has been challenging but achievable. The team has been able to deliver a working version of the app that fulfills all the must-have, should-have, and most of the could-have requirements. One of our most notable achievements include implementing a complex but effective class diagram system, which allows for easy development in the future. Our design uses design patterns, has high cohesion and low coupling between classes, and thus we have been able to carry out testing on individual sections of the application. And finally, when we created the UI, it was both clean and user-friendly, and able to provide an excellent user experience. We hope our clients at Guy's and St Thomas NHS Foundation Trust find our mobile application extremely useful and easy to use. Thank you for watching.